That's all the eardrum here. The skin have been elevated partially from the canal, and now the next step will be to enter the middle here.
Jean-Marc, do you reckon you could focus?
Yeah, that's right. Focus there. Okay, that's better.
That's a bit better, yep.
Okay. You see, with this instrument, I just pushing the skin away from the bone to slowly elevate the skin until I reach the eardrum. See, and there I'm slowly reaching the edge of the eardrum. I'm going now to elevate the central part here. So slightly pushing this skin away. Until. So this is, you see the depression of the instrument show me that just above the sulcus, and in the sulcus there is an annulus, which is a white ring, which is basically the edge of the drum of the membrane, and I will show you how we go inside and under it, because I need to elevate this annulus from the sulcus to go under the eardrum. The sickle knife again. So now we are going to enter the middle here. So I slowly scratch, the edge of the bone to try to go under this white annulus.
That sickle knife has entered the middle ear, and then
Yeah. No, you see. And now I will create enough gap to use my drum elevator. See the whitish on the left of my section? That's the annulus. And there is a bit of mucosa in the middle here, which has just opened. And now you can see the promontory and the middle here, the drum elevator. So first thing I will try is to make this eardrum disappear from our view. So we give a nice view to the middle here, but also we give a lot of light in the middle here. So you see I go under the eardrum. I push this eardrum until it will fully disappear from us and until it doesn't want to come back and annoying us during the surgery. So that's the first thing. So now we are going to move to the upper part. So I'm pushing this eardrum. See, this eardrum disappeared until I see something behind the corner, and I will show you, which is the malleus. The malleus is there, and I will have to continue to lift this eardrum until we have a full view on the malleus. I'll tell you when to go. Yeah, you can go. Yeah.
Now, what Jean-Marc is trying to do now is remove a bone of the ear canal to be able to see the full view of the stapes.
Yeah, good. And now, yeah, you can go. Yeah. Thank you. Yeah, I just need to detach a little bit the eardrum here because the eardrum is touching the. Here we go. Yeah, and now the So sorry, stape is here, incus here, facial nerve on the left here, and the foot plate is shining here at the end.
Down here.
So first, I'm going to push on the malleus to see if the malleus incus respond well, which they do. So I don't know if you see when I push there, you see the malleus moving. And when I touch the stapes here, there is clearly an anterior fixation of the stape. So yes, it's an otosclerosis. Okay, the next step now is to disarticulate the incus from the stapes. So I'm going to move that to see where I can decoapt, and I can see here the joint. So I need to go slowly to this joint to detach the incus from the stapes. Voilà. So now I could feel and see that the stape is detached from the incus. So you see left of my section, stapedial tendon, top left of my section, the posterior crus of the stape, and then, you know, anterior to that, where it's a bit shiny, that's the foot plate. And then on the left here, you know, that's the facial nerve here.
All right, so Jean-Marc is using a green otology laser to divide the stapedius tendon. Oh, he's already done that, and I think he's dividing the posterior crus of the stapes and now the anterior crus. This is to sever the stapes superstructure from the foot plate, which we think is fixed in these patients.
And the black hook, yeah, laser on hold. And the alligator. So you see, that's the superstructure. I can give you a better look on it. I will take it with the alligator. So that's the arch of the stape which have been cut with the laser and removed from the foot plate. See, that's the stape is removed. Can have the 4.5 measurer. So I'm going to measure the height between the foot plate and the incus to make sure that the piston is long enough. So this is a 4.5 millimeters instrument, which helped me to see how much I have to go. Yeah, 4.5. So I'm a little bit above 4.5 millimeters length, and I'm going to use a 4.5 to make sure we go deep enough on the laser. So now I'm going to make this foot plate dry and fragile with the laser again. Yeah, laser on. So you see, and I make it fragile, and there is a bit of perineum coming out. So now I'm going to use a very small drill, 0.7 millimeters diameter, to perforate the foot plate.
The width of the prosthesis is 0.6 millimeters, so that's why he's using 0.7.
And you can open a 4.5 millimeters. Yeah.
So that's a drill.
Yeah. Okay, and you see, I will slowly suck to show you, but I just perforate now the foot plate. Yeah, and the piston. Put a little bit of water on the speculum to put the piston in the water to really make sure I put this piston in the best position for me, which is, you know, standing up like this.
You can see that there's a hook that's meant to go around the incus, and then the white bit, down near the bottom, that goes into that aperture.
So I now refocus on the stapes and the foot plate, and I will try to put the prosthesis in the hole first, and on the incus after. Yeah. Cheeky on this one.
Often the most tense part of the procedure.
Okay. So I'm going to do it now. You see the crimping happen and a bit more. Okay, that's very good. One size smaller sucker. So now the hook is crimped on the incus, and I will just verify it and try to unbend a little bit my piston, which have been a bit bent during the manipulation. And the laser, okay. And now I will push on the incus, and you will see this piston going in the inner here. You see? I push, and it's going in the inner here to send the mobilization. Okay. I will just do one more crimping on the incus to make sure that it's well coupled. And so the laser. And that will be it with the laser after. Okay. And one more. Yeah, you can turn it on. Okay. And we are done. So now I will de-zoom and redrape the eardrum.
And then the anaesthetist will wake the patient up. So I might maybe put this in the corner, and then
and you can just give me some big fluffy gel foam. Yeah, big fluffy. Yeah, chop